Hi, good afternoon. My name is Linda Chome, and today I'll be performing a head-to-toe assessment while focusing on the cardio and respiratory assessment for my simulated patient. She's going to introduce herself and also consent to being video recorded.
Hi, I am Sierra Amos. I was born in 17th of October 1995 and I consent to be video recorded.
Thank you, Sarah. So before I continue, let me do a 360 environment check to show there is no one else. There. Okay. I'll perform hand hygiene, provide privacy for my patient, and what brings you here today?
So I do have cough.
Cough.
Yeah.
This cough. When did the cough start?
Started last week.
Last week. That will be how many days now?
That should be. It started on Wednesday last week, so that should be today's Thursday. So that should be 8 days now.
8 days. Okay. Have you taken anything for the cough?
I took just Tylenol.
Tylenol. What makes the cough better? And what makes it worse?
It gets better when I rest and wake up, and after I must have run around, done some things in the house, then it becomes more severe.
Do you feel any shortness of breath or?
Shortness of breath, not really, but when the cough becomes like frequently, it gets so intense, and sometimes too, it could affect my breath.
Okay. Do you have any pain, any chest pain when you cough?
Yes, I do. I do have pain when I cough.
Okay. What's the severity of the pain on a scale of 0 to 10? 0 being no pain and 10 being the most pain you've had.
The pain is when I wake up at first, the pain is around 4. Then as I move around, get on with my day, it increases to a 6.
6. Okay. Does the pain go anywhere else or just in your chest area?
Oh yeah, it actually does radiate to my back.
To the back side.
Yeah.
Okay. Do you cough out anything or it's just dry cough?
Sometimes I do. Sometimes when I wake up, I cough out to clear out my throat. So I do cough out some mucus.
Is it clear mucus or does it have any color and is there any smell?
Yeah, sometimes it comes out to be yellow, yellow sputum, and sometimes it's clear. But the smell, I don't know because I don't perceive it.
Okay. Do you have any allergies?
No, I don't have any allergy.
Are you taking any other medication aside from the Tylenol that you've taken so far?
Just Tylenol.
Just Tylenol. Okay. Do you have any family history of tuberculosis?
No, we don't.
COPD?
No.
Have you traveled out of the region or the country?
No, not recently.
Okay. Have you been in contact with anybody who has cough or any flu symptoms?
Not that I noticed.
Okay. Have you had your flu shots for this season?
Yes, I have.
You have. Okay. That's good. Okay, so I'm going to go ahead and I'll listen to your lung sounds to ensure that they are clear. I'll also listen to your heart for any heart murmurs.
Continue.
For any heart murmurs and yeah. Okay? Is that okay by you? And during this assessment, I'll also be touching you. Is that okay by you?
Yes, I do consent to that.
Okay, thank you. You understand?
That's okay.
Before I continue, at this point, I'll wear my gloves and look at my wrist. I'm just doing like a general head-to-toe assessment for her first. So I'm looking at her ears, and they are symmetrical, they are aligned properly. Her eyes round, they are equal, and they react to accommodation and light. Her skin color is consistent with her ethical background. She has a little bit of striae on both arms. Um, her stomach is a little rounded. Um, I feel no masses on her stomach, on her abdomen. Okay, so I'll start up with with auscultation first. So I'll first listen to her heart sounds, her heart murmurs. So we're listening for any murmurs or whispers, and to listen to the heart, I'll be using my stethoscope, and I will start with the aortic valve. Come forward. No, face me. I'll start with the aortic valve, which is mid-sternal border, second intercostal space. I'm listening for the lub-dub sound. The dub, which is the S2, is loudest on the aortic valve, which is on the right. Then now to the left side, which is where we have the pulmonic valve, second intercostal space. I'm listening for the lub-dub sound as well. The dub sound, which is the S2, is also loudest there. Then I come down to the third intercostal space where we have the Ebbs point, and I listen there. The S2 is also loudest. Then I come down to the mitral valve, which is on the fourth. We're still at the mid-sternal border, fourth intercostal space. The dub is also loudest there. Then I go to the fifth mid-clavicular line and listen to the tricuspid. The S1 is loudest at the tricuspid. Then at the mitral apical pulse, I listen for one and count for 1 full minute. I'm counting her pulse there. Her pulse is 66, which is within the normal range of 60 to 100 for an adult. So now I'll use the bell to listen to the heart murmurs. I'm listening to see if there's any whooshing sound or any murmurs in her heart. Just the same point, the aortic, where I have the valves, that's where I'm going to also listen. I hear no abnormal sounds. So now for her lung sounds, I'm going to listen to her lung sounds, starting from the apex, and then I'll come down to the second intercostal space where we have the upper lobes, and then the middle lobe for the right lungs, and then go down to the lower lobes. We'll do that for the anterior and the posterior side of. We'll listen to her lungs on both sides. So and every time I move my stethoscope, my patient is going to take deep breaths. She'll breathe in and breathe out. So starting from the apex, which at the clavicular the clavicle, breathe in, out. Okay. Then I come down to second intercostal space. Second intercostal space on the right. So I'm listening to the upper lobe of her lungs now. Then I come down to third intercostal space, which is mid lobe of the right side. I do the same for the left side. Then the fourth intercostal space. Fourth intercostal space on the right. And I come down to the fifth intercostal space to listen to the right lower lobe. And fifth intercostal space on the left. I go to the mid-clavicular line to the sixth intercostal space, and I listen to her lower lobes as well on the left. And I do the same for her right. So far, I hear no crackles or wheezes or any stridor, and she's also not using any accessory muscles to breathe. So now we're going to do the posterior assessment. So for the posterior assessment, I will do the apex first, and then landmark for the other parts of her. So starting from the left, I'm listening at the apex. On the apex for the right. Then I come down using her what's this called? From the C3 here, C7, I trace down to the T3 and to landmark for my second intercostal space to listen to her right upper lobe. Then I do the same for the left side. Take a deep breath. Then I trace down to the T10 and listen to her right lower lobe. And I also listen to her left lower lobe. Okay. Sit down. So far, there are no crackles or wheezes, and she's not using any accessory muscles to breathe. Her lungs are clear. Her lung sounds are clear. There is no abnormalities there. So I will have my patient's vital signs are also within normal range. Of her blood pressure is 120/85. Her pulse is 66, like I mentioned earlier. Her oxygen saturation is 99% in room temperature. Temperature is 36.2. My patient seems to be in good condition. There are no abnormalities with her breathing or anything except for the cough that she has. So I will make my notes and documentations and forward that to the doctor to follow up with her. I think this brings us to the end of the simulation. Thank you.